Uh-huh.
Just a second. Okay.
Yeah, some of these things do happen. Oh, Waleska is here. Waleska wasn't able to tell whether or not she'll be able to join, but you are here. So welcome, Waleska Kayako. Hi everyone, sorry, but I just could enter. But I just could
Hi.
could enter.
Hi, Charles. How
Hi.
are you? I'm sorry that I'm too late, but I almost could not have make it, but now I'm just being listened because I'm driving. So, hi everyone, and I just want to say hello to you, and we'll keep it till the end of the meeting if it's possible. Okay?
Perfect.
Okay.
Perfect. Nice to have you. You're just in time. We had a few logistical challenges with our devices, but we are almost there now. So we're just waiting to start.
Thank you.
Perfect.
Are my slides visible now?
No, not yet. We are just seeing your desktop screen.
All right.
If you just open that presentation.
Yes.
Once it is opened in whatever platform it is, then don't do anything else. Just go at the bottom of your screen and then click share. Then whatever you opened earlier, yes, it is coming up.
Okay, thank you. I don't know what's happening, what has happened today, but I'm so sorry.
Okay, you are there now. You are there now. Just ensure it is in a presentation mode.
Yes, is that?
Yes, perfect. Okay.
Yes.
You can go ahead.
Okay.
And sorry everyone for the challenges.
So I'll begin again. Good afternoon, everyone, and welcome to this capacity building session on strategic science communication for global non-communicable diseases prevention. Now, we'll explore how to turn your research evidence into impact. And this is impact for policymakers, for communities, for media, and the broader science community. So by the end of this webinar, you will be able to have tools to communicate non-communicable diseases research clearly, to engage with stakeholders, and to amplify your research impact globally. So before we start, I'd like to let you know that during this webinar, I'll ask a few short questions to understand your experience and opinions about science communication. And this participation is completely voluntary, so you can choose not to answer any question at any time. And of course, the responses will be anonymously used to help improve this session and similar trainings. Now, by participating, of course, you're giving your consent for your responses to be used in the way I've just described. So, what are the objectives of this webinar? So, by the end of this webinar, we should be able to understand why science communication is critical for non-communicable disease prevention, why we should be able to apply structured approaches to communicate research effectively. We should be able to tailor messages for different audiences. That includes communities, policymakers, and the media. We should be able to translate research findings into actionable recommendations and policy briefs. We should be able to measure and demonstrate the communication efforts. So quickly, just to have some kind of interaction, I would like to ask some of you, in your own words, what do you think science communication means? Maybe I can, any hand. If there's no hand, I'll choose randomly. Okay, Vincent Were, I can see you, the screen. What do you think in your own words? What is science communication? Okay, Waleska We have, yes, Charles.
Yeah, we have two Charles, but let me go as the first Charles.
Yes.
As the second Charles, Charles number 2.
All right.
I think science communication would be to establish a way in which you can communicate your science work to another audience. Can be science audience or policymakers or institutions, government institutions, or any other person that is a recipient of the work that you have done. Maybe you want to give you want to disseminate your findings to your stakeholders. So that, I think, will be my way of explaining science communication.
Okay, thank you. What about you, Aleska Kayafa? What is science communication, according to you?
She said she was on transit, so maybe she may not be able to speak.
All right. Okay, so okay, we go to the second question. That is, have you ever tried explaining your research to someone outside your field? And if yes, how did it go? Who will attempt that one?
I can try that one.
Yes, please go ahead, Vicky.
Well, I think, yeah, thanks. I think from my perspective, we actually were talking about today, I think part of it is just to be very clear in your own mind. So making sure you understand the theory of change in terms of what your work is trying to achieve and who the end user is. And I think using simple language, like for example, instead of saying 20%, you can say 1 in 5 and those kinds of, so in other words, language which is more accessible. And boiling it down to the crux of what, less about the methods and more about what you hope to achieve, I think.
Okay, good. So,
can I
yes.
There is Georgiana.
Yes, Georgiana, yes.
Georgie.
So, hi everyone. Just wanted to add a little bit to what Vicky said. And to give a personal experience. So some of the work I do is with small island developing states looking at climate change and health. So I was talking to a medical colleague about what we were doing, and I was using the acronym SIDS. And the person had no idea what I was talking about because it didn't make sense. Because in the medical fraternity, SIDS is sudden infant death syndrome. So I just wanted to say that we would need to start with very clear definitions of what we're talking about. And I just wanted to add that personal anecdote. Thanks, over.
Mm-hmm.
Right.
Thank you for that. Anyone else? Okay, we go to the next question. Who do you usually share your research with? Is it policymakers, communities, colleagues, or peers, or who else? Gladys Odhiambo, will you attempt that one? Kindly.
Pretty much the people who've been listed, but I would say sometimes you can also share your findings with funders so that they can maybe set aside budgets for you, and so that they can also be interested in the kind of work that you are doing.
Thank you. Kavata Maluni, who do you usually share your research with?
I would say colleagues and peers. Interactions with communities are usually limited, and so is policymakers. And then I would also say the broader academia, because once you publish your work, it's out there to be read by those who are in the same field as you are. Thank you.
Okay, thank you. Clarisse Mapa from Cameroon. Bon après-midi. Who do you usually share your research? Oui?
Yes, thank you. I have the opportunity to share my work with, I think, this different type of stakeholder. I had the opportunity into the JDA network to share with policymakers. And usually, of course, we share with colleagues or peers and so on. But I can say that the interaction with the community is more or less than the other stakeholders. Thank you.
Okay, good. Thank you for that. Now, the next one, on a scale of 1 to 5, how confident are you in explaining your research to non-scientists? Faye Wyers, can you attempt that one?
Hi, I think I would say 5, because over time one is learning to use simple terms and to break it down to make sense to whoever you are talking to. So I still need to learn more, but I would say 5.
Monica, can you kindly attempt that one? On a scale of 1 to 5, how are you confident in explaining your research to non-scientists? Okay, we have Zulfa Albertine. On a scale of 1 to 5, how confident are you in explaining your research to non-scientists? Are you confident at all? Are you very confident? Not confident at all? Marian?
I don't have research of myself.
Yes, like on a scale of 1 to 5, how confident are you in explaining your research findings to non-scientists?
As a health coach, I don't have my own research. I work with people, so I am the communicator of research, of other people's research. Yes, so, but it depends on what it is. I'm still learning, so I'd say for a 3.
A 3, yeah, okay, that's fair. What about you, Kumalo, David?
I think I should say is 2. The reason why I say it's 2 is because I'm not yet competent, or I feel I'm not competent in breaking down large information or technical terms or jargon into an everyday language that someone can appreciate and understand or value the information. So I think that's what I can relate to. Thank you.
Okay, thank you. Mfondo, Blanche, what about you? How confident are you in explaining your research to non-scientists?
Sorry, I'm just joining, so I'm kind of lost.
Okay, let me make it easy. You know, like you have your research findings, you want to explain it to non-scientists. Will you be confident? Are you slightly confident? Are you very confident in doing that?
I think it goes for 2 ways with me. When I don't know how to use the word in English, when I know it perfectly to my fingertips, I'm very confident to explain it. But when I have a little bit of doubt, I am slightly confident, and I'm not sure if I'm going to deliver it properly.
Oh, you said maîtriser.
It depends on the steps.
You the word maîtriser.
If I really, it's a French word.
Yes, I know maîtriser is to master. Yes, you've mastered.
Master, yes. If I can master it, my fingertips, I know it very well. I'm very confident to explain it. But when I'm not certain about some things, I'm slightly confident about the whole thing, and I find it difficult for me to put it out there.
Merci beaucoup. Vous avez bien répondu à cette question. I speak a little French, Don't worry. Yeah, you've answered that question very, very well. Merci beaucoup. Thank you. Yes, so we go to the next question. So why did you decide to join this webinar today? what is the main reason why you felt I must join this webinar? Soraya, are you with us?
Yes, I am. Thank you for the webinar today. Because I'm interested in understanding the impact of communication and using your model for science communication. It's the first time I heard of it, and I was invited to join the webinar today.
Thank you. Yes, Zulfa, are you on board? Are you with us right now?
I am, but I'm currently also taking care of my 2 kids, so it's quite tricky for me to respond. Sorry.
All right. Okay. Thank you. But it's still good. You are listening. You're following. LS, are you on board?
Yes, I am in a very noisy place.
Oh, all right. Okay, so now.
But you can ask the question again.
Okay, now I have 2 questions. Why did you decide to join this webinar today? And have you ever heard of the biomodel of science communication?
I'm hearing about biomodel communication today, and I'm here to learn. Thank you.
Okay, good. Thank you. Monica Eomaz. Yes, Monica, are you with us? Okay, then we have Georgiana Gordon. Are you with us?
I am with you, Doc.
Okay, so why did you decide to join this webinar today? And have you ever heard about the biomodel of science communication?
And just like my colleague before me, I'm hearing about the biomodel for the first time today, but I have a keen interest in the translation of research to policy, and that involves a lot of different modes of communication. So I'm really looking forward to learning your model and to applying it to work that I'm currently doing. So this is actually quite timely for me. I have one apology. It's unfortunate that I have to leave this meeting very shortly, and I was just sending a note to Charles to ask him if it was going to be recorded and if I could get a copy of the recording. So I want to say thanks to you, Doc. I'm finding your webinar so far very engaging, and I'm really very sorry that I have to leave. Charles, I really hope this is being recorded because I'm coming back to it.
Yeah, perfectly well, Georgie. We are recording, and I will share the recording afterwards.
Thank you, and thank you so much, Doc.
Okay, all right. Thank you. So now, quickly, let's. I'll try to be a little quick and fast. So science communication, we've defined it, but I can give a general definition. It is the practice of sharing scientific knowledge, methods, insights with any audience, experts or non-experts, in ways that support understanding and the advancement of science and society. So generally, science communication is how we share science with others so that they can understand it and use it. So the magical word there is so that that understanding, if they can understand it, then definitely they'll use it. Now, our webinar is titled Turning Evidence into Impact, Strategic Science Communication for Global NCD Prevention. So what is this turning evidence into impact? So this means we are taking our research, the research results, that is the data, the experiments, the findings, and making them useful in the real world. Let me give you an example. If your study finds that a certain diet reduces diabetes risk, turning evidence into impact means helping communities, means helping policymakers or health care workers to apply that knowledge and statistics. But how can they apply that knowledge? So they, now with that example, where your study finds that a specific diet reduces diabetes risk, how you turn this evidence into impact, it means you help real people use that knowledge in practical ways. If it's communities, for instance, you can make it doable in daily life. You share simple meal plans based on your findings. You demonstrate affordable food swaps. For instance, use brown ugali or instead of white ugali, you know, hold community cooking demonstrations. Now the impact there is that people change their eating habits because they understand what to eat and how to prepare it. Now on the policymakers, turning your evidence into policy options, no? But how do you do that? You show how promoting this diet can reduce diabetes cases and healthcare costs. You recommend policies like healthier school meals, food labeling, awareness campaigns. You provide a page policy brief with clear actions. The impact there is that decisions and budgets begin to support healthier food environments. Then we have the healthcare work. Now, with this audience, you help them translate research into patients' advice. You create a simple counseling guide based on your study, provide ready-made posters or handouts for clinics. You train them on how to advise patients using the new evidence. So the impact here is that patients receive consistent evidence-based guidance during visits. And then we have the media and journalists. You make the story accessible to them. You offer short media advisory with key messages, give relatable examples, and use infographics for quick storytelling. No, the impact there, the public will hear. The public hears clear, accurate, and motivating messages. So, now another question that just to joggle your minds: who do you think should be the first person when you're communicating your research? Gladys Odhiambo, who do you think should be the first person when you're communicating your research? And what happens when researchers communicate only for themselves? And has your research ever been misunderstood because of how it was communicated? And who do you think needs your research the most? So if you can answer those 4 questions, it would be a good thing for us. Gladys, please go ahead.
Wow, that's a lot. But I think the first person I think about when I'm communicating the research is the person that I target. Is it a policy person? Is it an accomplished researcher? Is it someone who is just getting into the field? Is it a community member? And even the community member, what's their level of literacy and all that? So I think about the end user of the information that I want to relay. So I'm supposed to answer all the 4 questions?
Yes, please. Briefly.
What happens when you only communicate when researchers communicate to themselves only? I think there is no communication there. I would say there is no communication because the people who are supposed to understand what you're talking about and then use the information are not being reached out to. And has
your research ever been misunderstood?
Of how you communicated it. I would say to some extent, yes, but I think during dissemination, maybe when you are in conferences, that's why sometimes you get questions, and because you're still there, you're able to clarify. So that would mean that maybe how you approached it when you are delivering your information was not the right way. And who do you think needs your research the most? I think the end users, and the end users here can be the community, the people who you want to maybe implement a particular policy. After you define them, then I think you should design also your communication according to the needs or according to how you want the information to be beneficial to the community at large.
Okay,
not just the science community, but the general public.
Okay, thank you for that. Charles Luanga, can you attempt the 4 questions? Charles, are you on board?
Right. Sorry, I was muted. Yes, thank you so much, Dr. Baya. I don't know how much time we have, but yes.
Just very briefly.
I think when you have your research, then the first person is to yourself. Do you understand? Do you hear yourself so that you're able to communicate it to the other person, you know? And then in terms of the audience that you wish to reach, basically you wish to reach everyone. However, you have a target population. So what is your study all about? Is it about, pregnant mothers? Is it about, households within a community in terms of food security? Is it about children? So it should be targeted. Policymakers, are they able to understand you and the results of this study? So if you're able to communicate to them, that target group, then you are home. And then when researchers communicate only to themselves, there are two sides. One, it is a good thing for them to, communicate within themselves. How does this study relate to you as a scientist, as a researcher? Is it making sense to you? But then we need to get it out there as well, because beyond the research table, there's also the other audience, the communities, the policymakers, the stakeholders that are yet also to be reached. So, and it is possible that a research result can be misunderstood because of how it was communicated. Was it the language? Was it the environment, the platform? Where was this being done? Which media was being used? What language, were you using? And is the audience being able to relate with your message? So, whom do you think needs your research the most? I think I've responded to that. Thank you.
Okay, thank you. Now, let me quickly give you the story of the hidden study in a drawer. Now, a few years ago, a research team in Kenya spent 2 full years studying how eating traditional vegetables like kunde, managu, and terere could reduce the risk of diabetes and high blood pressure. They collected data, analyzed blood sugars, compared diet patterns, and eventually wrote a beautiful 45-page scientific report with excellent graphs and statistics. When the project ended, they submitted the report to their institution, and then it sat in a drawer. The researchers had done amazing science, but nothing changed in the community. Nobody outside the research team had even heard of the findings. So one day, a community health worker named Miriam visited the office. She saw the document and asked, "Why didn't anyone tell us this? We are teaching nutrition every week." So she took summary notes from the study home to her clinic and started teaching mothers in her group sessions about adding traditional vegetables to their meals twice a week. Within 6 months, families started planting kitchen gardens, and the clinic recorded fewer cases of uncontrolled blood sugar. So nothing in the science changed, only the communication did. So the evidence was already there. What was missing was turning that evidence into impact. So the key message in this story is that research is powerful only when someone hears it, understands it, remembers it, and uses it. That's the difference between a PDF or a document that nobody looks at or opens and a message that changes lives. Now, when you talk about strategic science communication, not all communication works the same way. And strategic communication means planning carefully how to share your research so that it's understandable, memorable, and actionable. It's about choosing the right audience, the right format, and the right message. For example, you wouldn't present detailed statistical models to high school students. You'd simplify and use relatable stories. So, strategic science communication is the purposeful, planned, and audience-focused sharing of scientific information in a way that achieves a specific goal, such as informing decisions, changing behavior, influencing policy, improving public understanding, or strengthening trust. So, now, when we look at global NCD prevention, we are looking at these non-communicable diseases, the diabetes, the cancer, the heart diseases, and so on. So, in simple terms, turning evidence into impact, and when we're talking about strategic science communication for global NCD prevention, it's all about how do you share your research clearly and strategically so that your work on preventing diseases like diabetes, the heart disease, actually makes that difference in people's lives around the world. So why does science communication matter? Why is it important? You know, why are we looking at, why are we focusing on science communication? So that alone is not enough. And stories and context, they make research memorable. Clear communication increases impact. And how does that happen? Let me give you a quick example. In Kisumu, we studied how adolescents were exposed to sexual content online. Now, instead of starting with statistics, we told the story of a 14-year-old girl navigating social media without guidance. Policymakers and teachers suddenly understood the urgency. The research became real and actionable. And that's the power of strategic science communication. Instead of the statistics, we gave a story. We just told a story. So, why does science communication matter for NCD prevention? One thing we know is that diabetes, hypertension, cancer, and other non-communicable diseases are a growing global burden. Even if we generate high-quality evidence, it has very little effect if it stays on the shelf, or the drawer, just like the story I gave you a few seconds ago. So effective communication allows us to influence health policy and guidelines, engage communities in prevention programs, shape public behaviors and awareness, gain visibility for research that can attract funding. And an example is a study on adolescent lifestyle behaviors that can help schools implement evidence-based nutrition programs, but only if the findings are shared clearly and compellingly. Not only sharing, but they should be shared clearly and in a compelling manner. So, now I'll quickly go to the common challenges in NCD science communication. What are these challenges that we face in non-communicable disease science communication?
Dr. Lawyer, there is a hand raised from Vicky.
Okay, yes, please, Vicky, go ahead.
Yes, thanks. That's why one of the things that's challenging is, as a researcher, the consequences of objectivity and advocacy. In other words, our role both as advocates as well as maintaining our scientific objectivity. And a lot of our research might be underpowered, or it might be promising, but it doesn't meet the sort of standards of probability testing and so on. And at what stage, I mean, how do you draw the line? Because there's nothing more frustrating than getting to the end of a systematic review and somebody says more research is needed, because more research is needed about everything. So how do you draw the line in terms of, like, how much evidence is enough to communicate, or how can you communicate uncertainty around your findings, but where it's promising? I think for a lot of us that's tricky, because, you know, as researchers, we also want to, we're very much around wanting to communicate, but we also have the difficulty around the complexity of, if it isn't compelling, we still need to disseminate it, and we have to disseminate uncertainty.
Mm-hmm. So, so your question is about how do you disseminate the uncertainty?
No, I guess what I'm saying is that what you're describing is something in terms of, well, when we've got findings which have clear policy implications, or where the actions are clear, and it makes it easy to actually disseminate to the end users or to policymakers. But a lot of the work that we do, the findings might be equivocal, or they might not be as compelling, or they might be showing a direction, but it might not stand up to sort of a probability test. So how do you convey findings that are, I mean, we have to keep the line between advocacy and objectivity. So how do you convey findings which may not be conclusive, but that are, I mean, like, for example, during the whole COVID pandemic, so there are some things which show a direction, but may or may not be conclusive. So, but
yes,
and it's frustrating because you need to actually convey uncertainty, but also, some direction.
Okay, thank you for that question. And the reason why we're having this webinar, mainly one of the main reasons is to answer your question. And I will do that shortly using the BAR model of science communication. We'll go through the 4 steps and you will see that your question has been answered. We'll revisit that question once we're done with the BAR model of science communication. But now, just to stick to that, I've noted your question down. We'll revisit it. But maybe I should also hear some, I mean, maybe we can get some challenges that from others as well. What challenges make it hard to turn your research into real-world impact? Because that's where your question falls. And anybody who would want to give give their challenge that will make it very hard to turn their research into to make it impactful. Yes.
Faye, could you? You're not clear. Faye, you can't hear you.
Can you hear me now?
Still coming from a little bit far off. Okay, just try. Maybe go to get to hear you. Just try. All right, I think we may have lost Faye, the communication. Is there any other question, comment as we go along so that...
All right. So anyone with a challenge that will make it hard to turn their research, that a challenge that they've encountered, something they will want to share?
I see Faye is back. Faye, you able to speak now? Oh, yes, sorry. That is...
yeah, I can hear you,
Faye. Let's have...
yes, I think
wait, let's have...
I can hear you, Faye.
Okay, there are 2 challenges. I think the first one is that the time it takes to actually turn around the communication due to bureaucracy, different levels. So by the time it's out there, the information might not be relevant, or you might think might not be relevant, and you have to wait for another research to verify what you've done a while ago. So the time it takes to bring out the evidence or the communication, that's one. And then the other one will be the fact that, for example, you want to maybe present to, let's say, policymakers, decision makers. It takes a long time to get entrance to have that audience. So those are 2 challenges.
All right, thank you so much, Faye. We had another question or comment from Dr. Vincent. Vincent, go.
Yeah, mine, can you hear me?
Yes, yes.
Yes, yes.
Yeah, so I learned from the implementation research when we assess why research, the gap between the research and between evidence and practice. And one of the things we've learned there is that when research has been generated, there is often a lot of things that are lacking. One of them, the research will show us the effect or effectiveness, but there's later missing, for example, on feasibility of doing it. And then there is the issue of cost of implementing the program, and the knowledge of the policymaker is also inadequate, and also lack of information about sustaining this program, and even issues like cost-benefit analysis. So most researchers do not go to the extent of providing this evidence. And also in implementation science, we talk about lack of political interest or political priority. And there is a concept called political economy analysis, where researchers fail to even analyze the stakeholders who will implement this. They don't understand the politics, the manifestos of different political groups who are ruling the country at the moment. So many times the research ends up where it is because there is lack of implementation research. to understand the problems that ordinary policymaker is facing in the world. And then researchers also lack a framework to monitor the implementation itself. So they stop at evidence, and then now we have an area of research where we are trying to look at implementation, and it's really showing us where this is. Also, lack of co-creation. The process in which researchers develop grants is driven by donors, but it's not topics generated from the, let's say, from hospitals. The data is not generated from the people with the problem, because researchers can create hypotheses themselves and analyze and study and show the impact. So those are, and then lastly is the lack of budgets. Researchers don't budget for advocacy. They don't budget for, moving things through parliaments, through the East Africa commissions, the various committees. They don't do that. So that is one of the things I've learned in implementation research beyond this hardcore science. Thank you.
Wow, that is quite a mouthful. On the chat, Dr. Bayer, on the chat, there is from David, he says lack of consensus among experts makes it challenging to share research findings. Yeah. So back to you, Dr. Bayer.
Okay. So we can look at the common challenges. Normally, many researchers face barriers. The challenges or the barriers that many researchers face when communicating NCD evidence. Now, there's the issue of highly technical language that is very difficult for non-experts. There is also research findings being published in journals but not reaching policymakers or communities. We have the misinterpretation or oversimplification in media coverage. We have the lack of visual summaries or storytelling approaches. Also, there's the issue of data without context. And that means that we mean that numbers alone do not change anything. If you give people statistics, you give them graphs or research findings without explaining what they mean or why they matter or what should happen next, then people don't know what to do with the information. They can't make decisions. Nothing changes. So if you tell a community, for instance, 40% of adults have high blood pressure, that won't move anyone to act unless you explain. You explain why is this a problem, what causes it, what can be done, and how does it affect them personally. Now, the other challenge is monologue only. Using of monologue, it brings about disengaged audience. It means that you talk at people instead of engaging with them, and this loses their attention. If your communication is just about giving long speeches, lectures, presentations without no interaction, then people naturally disconnect. If you talk for 30 minutes non-stop, for instance, like the way I'm doing, if I just talk for 30 minutes non-stop, then the audience might stop listening. They might feel overwhelmed. They might stop asking questions. You see? The other common challenge will be forgetting to repeat key messages. You have to keep repeating the key messages throughout your presentation. When you communicate, you must repeat the most important points. Not once, not twice, but several times in different ways. If you say something only once, people tend to forget. People may miss it. They may not understand that it's important, or they may fail to act on it. So repetition matters because people remember messages through reinforcement, not one-off statements. So in communication, clarity does not mean simplicity alone. Clarity is also about repetition and also about consistency. If your main message is, for instance, early screening prevents complications, but if you only say it once in your 20 minutes talk or throughout your in your presentation, you just mention it once, then your audience may not retain it. So the other common challenge in NCD science communication is the other is to know that effective communication needs both data and context, and that way people will understand your message. And engagement is not about monologue. people will be interested where there is engagement. So, forgetting, as I've already said, if you don't repeat, people forget your messages. And I also mentioned about the jargon. It brings confusion. Yeah? Use big words, big complicated words. You have to be careful about your audience, you know. Use jargon, it will create barrier between you and your audience. When you use very technical, specialized terms that your listeners don't understand, then they stop following your message. The brain will switch from I get it to what does that even mean? So when you talk about jargon, we are talking about, you're bringing aspects of confusion. And when you confuse your audience, they'll be disengaged. And if you're looking at impact, you lose the impact. And that's what we're talking about, from evidence, turning evidence into impact. So one way is to stop using words that will confuse your audience when you're disseminating your findings, your science. Now,
all right, Dr. Baya.
Yes.
Sorry to interrupt slightly.
Yes.
Our time is quickly running out.
Yes.
I know we had challenges in starting. I don't know if 10, 15 minutes will be will suffice to get into the model. Yeah, because people are getting concerned.
Okay. Now, let's go straight to the Bayer model of communication. When we talk about the Bayer model of science communication, we mean B stands for break it down. You make your research very simple. And the A stands for audience. Who do you want to reach? The Y stands for telling a story, yield by telling a story. Show why it matters. And the A is about action. What should people do with it? So it's a framework. Bayer model of science communication is a framework that I use to communicate science strategically. It helps researchers turn evidence into impact in a structured way. Clearly, just to emphasize again, breaking it down, you simplify complex research into clear, digestible messages. Audience is identifying who you're speaking to. Is it policymakers? Is it the journalists? Is it the community members or scientists? And then turn your research into a narrative that resonates with your audience, and then activate. This is about call to action. Is it policy adoption? Is it behavior change? Now, a researcher, let me give you a quick story. A researcher once discovered that reducing sodium intake significantly lowers blood pressure. Instead of overwhelming people with lab results and statistical models, they simply said, cut 1 teaspoon of salt a day and your heart will thank you. Now, instantly people understood and changed their behavior. So this was about avoiding long scientific terms, using examples people know, using everyday words. That is on the breakdown. The Bayer, the B, the first B is to keep it simple. You simplify without also dumbing down. Break down your research into clear insights. Focus on key messages. Use plain language. If in a hypertension research, instead of showing all statistical models, one can say 1 in 4 adults in this audience has high blood pressure, and most don't know it. So the audience would understand that immediately. So simplifying in short does not mean removing scientific accuracy. It means making it understandable. So it's about simplifying your evidence. You can also use metaphors if needed. For instance, you can describe cholesterol as clogging pipes in blood vessels. So remember that breaking down your findings makes them understandable to anyone. Now the second, the A, the B, then the A is the audience segment. When you talk about audience, you're talking about audience segmentation. It's about knowing your audience. So you tailor your message according to the audience. Not everyone needs the same level of detail. Your audience decides how you communicate. So you must know, who are you talking to? Imagine if you're sharing your findings with 3 people. Your grandmother, a policymaker, and a fellow scientist. You can't talk to them the same way. Each one cares about something different. If you're talking to your grandmother, they need simple everyday language. A policymaker needs to hear about impact, costs, recommendations. A scientist will need technical accuracy and methods. So that's why the message must change depending on who you are talking to. So an instance there is like your grandmother will be interested about eating more vegetables and take less sugar. That is what you'll tell them. When you're talking to a policymaker, you can tell them this program can reduce hospital costs by 30%. That's what they want to hear. Scientists, you can talk about now. You can use that scientific language suited to them. Like we ran a double-blind RCT with 500 participants. So the tip here is that always ask, what does this audience care about? So identify who will use your research and ask yourself, whom am I talking to and what do they care about? So then the why. The why in the buyer model of science communication is about telling the story. Turn your research into a narrative that resonates with your audience. Engage emotions, create a story around your key insight. Pair data with relatable stories. Instead of just giving the statistic that, for instance, 45% of adolescents were exposed to some sexual content online, you can tell a story of a teenager scrolling social media without guidance. And suddenly the data becomes real, relatable, and memorable. Because stories are very powerful. Because the stories stick in people's minds. Audience remember the story and the supporting data. So yielding is about connecting data to human experience. So stories make your research stick and memorable. And people remember stories, not numbers. So you can structure a story like, you start with a problem, the evidence, the meaning, action. And now on the buyer framework, buyer model of science communication, we have the action, which is the last one. What do you want people to do? Why does this matter? You telling people to do is more effective than just giving general advice. So clear, specific actions that are easy to remember and follow. Instead of saying, for instance, exercise is good. As a health researcher, you can say walk 30 minutes 3 times a week and track your steps. So the audience now will have a concrete double plan, not just vague advice. So the tip here is clarity drives action. The more specific your instructions, the more likely people will follow them. So include a call to action, whether it's policy adoption, behavior change, further research. Give clear, achievable steps. Encourage immediate or practical action. Now, in a community workshop, after presenting data on hypertension, participants were asked, what can you do next? The discussion led to local screening initiatives within weeks. So why? Because of that question, what can you do next? So always guide your audience towards actionable steps. And that's how research creates impact. So that infographic is just an illustration of turning evidence to action. How you share your health, how to share your health research so that people understand and use it through the breaking down, audience segmentation, telling the story, and activating action. What do you want people to do? Okay. Again, if the finding is reducing salt lowers blood pressure, breaking it down is that you say too much salt is equals to high blood pressure. Audience, who is your audience? The community health group. Yielding, you're telling a story, a simple story like a family cut salt, and so they saw fewer hospital visits. And what's the action here? You start with 1 teaspoon less salt daily. And again, you can also tell them, share with friends this information. So again, there was a recent health research study found that adults who walk 30 minutes a day reduce their risk of developing type 2 diabetes by 40%. Now, when you use the buyer model of science communication, you will break down the finding by removing jargon and explaining the result in simple terms. For instance, you'll say, a short daily walk can almost halve your risk of diabetes. Next, you'll identify your audience. For example, your audience will be busy urban workers, policymakers, planning, community spaces, or community health volunteers. Then you yield by telling a short, relatable story, such as a worker who started walking during lunch breaks and improved their blood sugar levels within months. And finally, you activate, or you call to action by giving a clear action step tailored to the audience. You can encourage people to schedule a daily 30 minutes walk, persuade workplaces to support walking breaks, or urge policymakers to improve safe walking paths. So, a study among school children also showed that replacing sugary drinks with clean drinking water for just 8 weeks led to better concentration in class and fewer afternoon energy crashes. So to apply the Bayer model, you start by breaking down, turn the complex nutritional data into a simple message. You can say when children swap soda for water, they focus better and stay alert longer. Next, you identify the audience, that is the teachers, the parents, the school administrators, or the health policymakers. Then you yield by crafting a short story, such as a teacher who noticed that her class became calmer and more attentive after the school introduced water-only breaks. And finally, you activate by giving a clear call to action. Ask parents to pack water instead of juice. Encourage schools to create hydration corners, or advise policymakers to include water-only guidelines in school health policies. Now, quickly, do you think this model in some way has helped you think differently about communicating your research so far? Justina Maluni, are you with us? Do you think this Bayer model of science communication has helped you think differently about communicating your research?
Yes, it does. I like how you bring in the aspect of yield and also breaking down your information to ensure that it fits the different audiences, from the policymaker to the community member, and because all these people are actually key to our research work, and ensuring that you change your messages depending on the audience that you're going to be addressing.
Okay, thank you. Clarisse Mapa, do you think this Bayer model has helped you think differently about communicating your research?
Yes, thank you. Usually we try to simplify our message depending on the stakeholder we have, and your model give us the different step. Maybe we use them before, without a proper framework, but your framework give us the opportunity to have a different step in order to achieve what we want to do. So thank you.
Okay, thank you. Vicky Lambert, do you think the Bayer model of science communication has helped you think differently about communicating your research?
Yeah, I think I think the only one that I find a little bit difficult in terms of easy to interpret is the notion of yield. But when you describe it in terms of the sort of narrative and storytelling, I think it's a quite a useful model, and I think I mean, again, I think we need to be better about beginning with the end in mind, and by having this, and there are going to be multiple audiences. In Australia, they call them consumers, and I think that's also quite nice, as consumers of our research. And so as a result, we have an obligation, because most of us will receive some sort of funding either from government or from NGOs. So we have an obligation to do this well. So no, it's a very nice model. Thank you.
Okay, thank you. Charles Luanga, what's your take about this Bayer model?
Yes. Yeah. Perfectly. I think I was just about to raise my hand. I see this is actually a great way of going about it in terms of the message and the audience and the how to go about it. I'm just a little bit anxious when it comes to now the same audience and with the inbuilt mentality. For instance, I think an example would be make this clearer. in a school, in our setup here in Kisumu, you go to a school, during break time, you've mentioned about people carrying water or that kind of stuff. But now, a parent will pack, different foods for the child. You also will do the same. So you might want to pack, the indigenous food that you believe are more nutritious than the fast food, But now, because of the mentality that is inbuilt, your child may feel awkward, may feel ashamed, at a loss when he or she sees another child carrying, fries, chips, cookies, sodas, and fancy foods, such that you end up that the food that you pack for your child is brought back home because the child felt ashamed. Daddy, mommy, what you gave me is not palatable, is not good, while my friends are eating fancy foods, sweets and other kind of thing. So I'm trying to imagine, how to remove these in this kind of a mixed audience. Yet your message should be, for safety and the right kind of foods. So that is where probably we may need to speak a little bit further, later.
All right. I know that's one of, thank you, Charles. I know that's one of a frequently asked question. When you have mixed audiences, sometimes what do you do? But quickly, normally, generally, you focus on the main audience. Who's the bigger audience? Then you start with them. Then you trickle down like that. Faye Wires, what do you think about this model? And how
I think it's a lovely model. It's simple and one can remember it easily. Like I'm already starting to put down notes. So thank you for this. Very useful.
Okay, thank you. Vincent Were. Okay, Gladys Odhiambo. What do you think about the Bayer model of science communication? Do you think it has it helped you think differently about communicating your research?
Yes, I think the model is great. It simplifies what a scientist needs to do in a very clear manner, and it also stresses the need to understand the audience at the end of the day, even before you decide on what you need to communicate, so that you can know how to package the message to reach home. Thank you.
Okay. I can see Prof is online. I don't know, Prof, if you have a comment on this Bayer model of science communication. I don't know if he's with us. I know he was engaged elsewhere. Okay. What about Charles Luanga? Oh no, not Charles Luanga. This is all right. Okay. LS, is LS with us?
Yes, I'm here. I dropped a message in the chat.
Okay.
I think the model reminds me of the bottom-up approach, because before you finish, you think of whom you want to target, and in most cases the community where we work. Here we work with local community people that some are semi-literate, and it is important to package yourself well just before you start doing your research. So I really appreciate the model. Thank you so much.
Okay. What about Monica? Monica, are you on board?
I think that was
some people are dropping their comments on the chat box, and
okay.
they have to leave because of other engagements.
Okay. Now, in a minute, I'll be done. So we'll quickly go to let me just look at if I'll so how do I make my research actionable? This one, maybe it's a good one. You always include clear achievable steps that your audience can take. You can make this can be at the individual, community, or policy level. Okay, and another common question is so how do you handle questions or challenging audiences? You listen actively, you respond respectfully. If unsure, you acknowledge and offer to follow up. Use questions as a chance to engage and clarify your message. And how do you measure impact of science communication? So you can measure it through the policy changes, influence, the community programs implemented, the audience understanding or behavior change, media reach and engagement, and what if my audience is mixed? Charles, I don't know if this is related to your question or concern. What if my audience is mixed, like policymakers, community members, and other researchers all together? Was this related? Your question, was it related to this? All right, so you focus on your main audience first. Like, who needs the message the most? You speak in a way they will understand. After that, you add a few simple key points for everyone else. So, for example, you can start with high blood pressure affects many families in our county. That is targeting community and policymakers. Then, to target the researchers, you can say the study used 500 participants in a randomized trial. So, and then how do you use the biomodel of science communication? Clearly, we've gone through that. And how do you know whether your communication actually worked? So you check for signs of change, such as, are people asking more questions? Is there increased engagement, like shares, tweets, retweets, attendance? Community behavior changes. What are policymakers contacting you for more information? What are the surveys showing? Are they showing understanding or interest? Are health workers adopting your recommendations? Okay. Now that's it. There's an evaluation form I sent via the chat. There's a link. If you can find time, please, you can fill it in. It will help in future. I mean, this kind of trainings and to understand where to improve. So that's the. I come to the end of the presentation. Charles, over to you.
Thank you so much, Dr. Baya, for this. Indeed, it has been quite stimulating. I'm sure that we didn't have enough time. I'm sure we could still be going on, but as usual, this is usually never enough. So David says, "Thank you, Doc. Thank you for sharing your knowledge. I think the model will immensely assist in demystifying and decolonizing some concepts in my research area. The examples you gave are relatable. In my view, is this? In my view, okay, I think I'm having a little challenge with that. Yeah, so thanks for that. And then Faye says, thank you so much. Please share the recording and slides if possible. Yeah, I was coming to that. I have the recording, but now Dr. Bai will share with me the slides that I can in turn share with the audience. This research team from various sites, various countries. We call ourselves the GDA, the Global Data and Activity Research team, all over, from UK to Cameroon, South Africa to the Brazilians, Jamaica, Kenya, Nigeria. So it is quite a big team, I think about 7 or so countries. that are here, and we've been doing research on NCDs, preventions, and that kind of stuff. So thank you so much for this. This was quite timely. We need to know how do we make our work visible in terms of communication. You know, how do we communicate our work to the audience that is out there? And you mentioned about the various audiences that you need to regard or think about it before we start that communication. So thank you so much. I'm sure, I don't know if there is any question or comment before I hand it over to Prof, if he's able to speak, to wrap it up for today's. But otherwise, thank you so much for the people who've been able to join. This will go a long way in enhancing our research work. So is there a burning question or a comment before I hand it over to Prof? Going down once, going down twice. All right, so I assume that we are well taken care of. The rest will hear from the recording and also access the slides from Dr. Bayer. So, Prof, are you able to speak to wrap it up for us? Yes, please. Go ahead.
Good evening, colleagues. Good morning, colleagues from Jamaica. Thank you so much for attending the webinar, and thank you, Charles, for moderating. Thank you, Dr. Bayer, for making the presentation. It has been enlightening, I believe so, and quite an eye-opener. I don't have much. I just want to thank all of you for the time you've spent. Have a blessed evening. Thanks. Goodbye.
Thank you. All right. Bye-bye, everyone. Let's touch base again. Same forum. God bless you. Thank you, David. Thank you, Clary.